Okay, so here we are with a set of emergency medical dispatch cards. These are for the state of New Jersey. These are very simple cards because when we're trying to establish our dispatch priority, New Jersey only has two. Basically, they have advanced life support and basic life support. In other words, it's either critical or it's not. Now, most systems have between 3 and 6 different priority levels. New Jersey has just the two. So very simple for you to learn the correlation between priority and the chief complaint. So the first three questions are always the same. Until we ask, what is the emergency, we still don't know if this is fire, police, or EMS. It's only after we ask question 3 that we would know that this is an EMS call, and that would take us to this set of cards. I would prefer to see question 4 as determine age and sex of the patient, because once I know this is a medical emergency, age and sex are relevant, whereas the name of the caller is really not. I'd rather have this information because some of the decision trees and some of the decision making that we have to do will depend on the age and sex of the patient. That's medically relevant. It isn't until question 6 that we actually ask our first medical protocol question. Is the patient conscious? And so what we're doing is we're working from the most important thing, most important consideration that we could have for a patient to the least important consideration. And the most important one, according to the New Jersey protocol, is the patient conscious? And if the answer is yes, we go to this card. If the answer is no, we go to this card. If they're conscious, great. We go to the next question. Is the patient breathing normally? Great. Then, because they're conscious and breathing normally, we can get into the details. What exactly is wrong with this patient? Are they injured? Do they have an illness? We're going to narrow that down because we know that the critical stuff is not an issue here. If, however, the patient is not conscious, we go to the no card, and immediately it says dispatch ALS and BLS. This is the upper priority, the higher priority in the New Jersey system. This is a lower priority. And so unconscious, just dispatch ALS and be done with it, high priority. We continue on because we've done our dispatch based on not conscious. Is the patient breathing normally? Well, that would be great. The answer is either no, uncertain, or yes. And if the answer is no, we're going to our CPR instructions, or we're going to one of these other cards, depending on the answer we get to this question. Now, remember I mentioned, what is the age and sex of the patient? When I go to my CPR cards, these are age dependent. I'd want to know what age bracket I'm dealing with before I need to go to this card. And that's why I feel like that's kind of a more important question than question 4. If the caller is uncertain that the patient is breathing normally, there is a card that we will go to that will allow us to troubleshoot that with the caller. And if the patient is absolutely yes, breathing normally, but not conscious, we will go to the unconscious and fainting card, and that will give us another series of directions. Now, the next card is the index of chief complaints. We can divide any medical call into injury or illness. An injury or traumatic injury is something that happened to a person, and these are instantaneous issues. The person was fine, something happened, now they're injured. Medical chief complaint is a sickness or an illness, and these can develop over hours, days, weeks, years. So the onset between a traumatic injury and a chief medical complaint are different. Onsets for traumatic injuries are generally instantaneous. It could have been any amount of time that led to a medical chief complaint call. There are time-critical situations, particularly New Jersey has identified these as the ones they're most concerned about. And then over here we have some miscellaneous stuff, hazmat, infectious disease, vehicle and water, air medical procedure. These are all clickable links that the dispatcher would be looking at. If you're a dispatcher in the state of New Jersey, this is exactly what you're using. But again, this is universal. So on the first card, if the answer was, is the patient breathing normally, and the answer is no, that's not good. And we're going to go to CPR instructions. But how do I know which ones to go to? Did I get the age and sex of the patient? If I click on CPR child instructions, it takes me to A hyperlinked card. Does anyone there know how to do CPR for a child? Again, a decision tree. The answer is either yes or no. If the answer is yes, do you need help in remembering the procedures? Yes or no? No, I know how to do CPR. We tell them begin CPR on the patient now. I'll stay on the line if you need me until help arrives. So very often the dispatcher will stay on the line until EMS arrives in case anything were to change or we had to change the priority or the pre-arrival instructions that we're going to give the patient. We can go from here back to CPR instructions. Okay, here's our child CPR instructions. So if the person who said, yeah, I know CPR, suddenly forgot how to do CPR, here are the instructions. There are AED instructions I can click on. Is there an AED present? Yes or no? Well, if there is, we can go and we can check that out. This is why I needed to know what is the age and sex of the patient. Okay, so let's go back to the index. Our first question was, is the patient conscious? Yes or no? And let's say the answer was yes, the patient is breathing normally. This says we're going to go to the unconscious fainting card. And we can see that they have labeled that green. And so I know it's going to be unconscious and fainting will be green, and I'll click on that, and it takes us to the unconscious and fainting card. We continue on. What was the patient doing before they became unconscious? Is this the first time today the patient has been unconscious? Has the patient taken any alcohol or medication today? And let's say the answer is yes. There's a bottle of Tylenol sitting next to them, an empty bottle of Tylenol. I think they took the whole bottle. We link to poisons and ingestions. And we ask the questions appropriate to that. We'll look at a trauma incident. Let's look at stabbing or gunshot wound. Let's say you're in your case entry. What is the emergency? What is the number? Tell me what happened. Okay, this is a medical situation. Are they conscious? Yes, they're conscious. Is the patient breathing normally? Yes, they're breathing normally. Well, what's going on? Okay, so they were in a bar fight. And they were in the parking lot and got into a bar fight with someone, and someone took a screwdriver and stabbed them in the upper shoulder. Well, that's clearly a quick onset. And we go to our stabbing gunshot assault card and we ask what parts of the body are injured. When did this happen? Was it intentional? In this case, yes. Is the assailant still present? That's important because if the fight's still going on, this is also a law enforcement dispatch. Okay, we need to have police respond to that as well as EMS. What type of weapon was used? In this case, it was a Phillips head screwdriver. Is the weapon still present? It's on the ground. Is more than one person injured? No, it's only the person that got stabbed. Is there bleeding? Well, yes, there's bleeding. Where's the bleeding from? It's from their upper shoulder where they got stabbed. We're going to skip this question because that's irrelevant for this situation. I don't need to ask a pregnancy childbirth question for a stabbing. We go, how much blood can you see? How long have they been bleeding? Clearly, since the incident took place, is blood squirting out? This would be an arterial bleed. This would be bad. And if it is, we're going to go to our bleed control card. Now, because of the arterial bleed, we now know ACLS, high priority. That's all I need to know. I got this far. Is there any arterial bleeding? Yes, they're losing blood really quickly. And so we go right for our ACLS dispatch. And our main concern now is that bleed. So we might give post-dispatch instruction or pre-arrival instructions for bleeding to include the use of a tourniquet. But first, we're going to start with direct pressure. If they can have someone take a cloth and apply direct pressure to the bleed, could we get the bleeding to stop? We're going to stay on the line and give information to the caller for that. If a tourniquet becomes necessary, in other words, they can't stop the bleed, we continue on to how to apply a tourniquet. We give instructions for placing the tourniquet. We want to get that bleed to stop before rescuers arrive. Cards are just decision trees. We determine the first question, and then it takes us to another series of questions. For burns, asks the typical burn questions, but we get to, oh, was this burn electrical? Actually, it was an electrical burn. Then we go to electrocution and we ask these questions. All the while, we're waiting to get some indication of when we're going to dispatch this and on what criteria. Well, it took until this card to say, do they have an altered level, a decreased level of consciousness? Yes. Okay. Simultaneous ACLS and BLS. In other words, once we get anything on this column, we know that it's priority 1. But if we're left with only this column, not that big a deal. This is how the cards work. Now you have this card set included in your unit, and you can download it and explore it. This will be the basis for the quiz for the EMD unit. You do not have to memorize all of these cards, and no one expects you to. That's why the cards exist. You will be asked questions about particular scenarios that will lead you to your decision tree. And based on the decision tree, you'll need to use the cards to find the correct answer to the question on your quiz. We have one for psychiatric behavioral. If it turns out that, in this instance, the behavioral issue turns out to be something diabetic related, we go diabetic problems. The cards are interlinked. They're designed to just take you in circles, concentric circles, so that we're always coming back to the questioning process. We're always trying to get to the next relevant answer. Again, don't try to memorize them, but know how to use them, because if you can pass your quiz by using the cards, that's all that's necessary. That's what the cards are for. I do recommend, though, that you go through all of the cards. I also recommend you take a CPR and first aid class, because it's very hard to give instructions to someone about, say, how to do CPR if you don't know how to do CPR. It's very hard to give instructions to someone about how to control a bleed if you don't know how to control a bleed. So you definitely want to have that under your belt. But as far as the cards, you don't need to memorize them. You just need to be familiar with them. You need to be familiar with what their definitions are and get a general sense of where each card is going to lead you under different circumstances. Just know how they work. You don't have to memorize them. This is where a lot of people get panicked, because this looks like a lot, and it is, but you're not required to memorize it. That's why the cards exist. Remember to tell yourself that. That's why the cards are here, so you don't have to memorize all of this. Once you're confident with that, you take your quiz and you pass, you can move on to the next unit. But I recommend take your time on this one. Don't rush it, because when you start working in call taking, this is going to be the most stressful aspect of call taking. When you get a medical call, that's the one that's going to make you wish you hadn't answered the phone. So we'll get the hard part out from the onset, and then dispatch for police and fire, much more simple than this.